Lorna, how's you?
Hello Rory, how are you?
Are you heading for a game of golf?
I am indeed, yes.
Good for you. And how long have you been playing golf, Lorna?
Oh, now, that would be about 35, 40 years I'm sure now.
Is that giving your age away, Lorna?
No, don't you do any sums.
And if you find that's helped with your recovery, Lorna?
Well, I do find that it helps clear your mind for a while because you are focused very much on playing golf and hitting the golf ball and maybe chatting with your playing partners and that.
So when did your recovery begin, Lorna?
Well, hello. My name is Lorna Stewart, and first of all, I would say I'm a wife, a mother, and a hard worker. Now, in my life, my family is important, and in fact, I believe this is where my problems began. In that, during my second pregnancy, I became extremely ill, so much so admitted to hospital for a long time. At that time I could feel myself dipping down, but had no realisation of how far I was going to dip after the baby was born. I had suicidal thoughts. I needed expert assessment. In fact, I was admitted to the psychiatric hospital that evening. However, my new baby, Gordon, he stayed behind in the maternity hospital. Understandably, I was quite distressed and for all sorts of reasons. Things gradually improved, a lot of medication was tried. Eventually it was decided I may benefit from electroconvulsive therapy. In my estimation, that was the time of greatest change, that something lifted. 2007, I was diagnosed with breast cancer. Initially, obviously, big shock. I went off for my first chemotherapy session and my mood went down and just couldn't cope. I had a daily visit from some people who tried to encourage me that we will get you better. With the passage of time and with my attendance at my local Beacon Centre, I started to feel better within myself. I gained some confidence. I am well recovered. I am enjoying my golf. I am enjoying my family. And the new friends now that I have met through the Mental Health Forum. I suppose another part of my involvement with mental health has been actually attending a training course on peer advocacy, which was held in my local Beacon Centre. I went along to the Service User and Carer Improvement Group, not really knowing what it entailed at the time. However, as well as acquiring a lot of knowledge about mental health issues and how we work with our trust. We decided as a group to enter a competition, and it was entitled actually Making a Difference, and it was to highlight the way that service users and carers can be more active in altering, changing mental health services for the better. And little did I know that a few of us out of the group were selected to go along for a face-to-face interview, and in fact after that interview we discovered that we had won our part of the competition. The winning award was to be presented in the Slieve Donard Hotel in Newcastle. We got to meet chief executives and other directors. We even got a bouquet of flowers and a box of chocolates. And really it was good to meet people who did seem interested in what we had been doing. There was an award this time put forward by our Health Trust, our Southern Health Trust, and they were called Excellence Awards, and we decided again that we would present a little report on how we felt the service was improving. The group has managed to attain second place in the partnership category. We all have to push ourselves forward, particularly if we want to make changes. My experience of my mental health problem is that I do live day by day. I take small steps. I increase my responsibilities. In fact, at the minute I'm responsible for a group of young girls and mentoring them about learning how to play golf, teaching them the rules, showing them a few basic strokes. Life is really good and can be good if you go for it. Just go for it and enjoy yourself.